Breakout Academy. My name is Mihaela. We will do a speaking session today, and we will talk just a little bit about speaking, and then we'll do a task. Maybe one of you would like to do the task with me. You will always be the medical professional, and I will be the patient. So we will do this together. I will share my screen in a little bit so you can see the task. About speaking in OET, you remember that OET is an English exam specifically designed for medical professionals who want to work or study in English-speaking countries. So we prepare you for OET with all 4 skills. And today we talk about speaking. And in the speaking part, you have 2 consultations with a patient. You will be the medical professional during the exam, and you will have a consultation with 1 to 2 patients. You have to be able to ask questions, so get information from your patient, and you have to be able to provide information, instructions, advice, give your recommendation regarding the medical issue of your patient. And then you have to be able to do that in 5 minutes. Now, this is a consultation, meaning a conversation. So you ask a question, your patient replies. The patient asks a question, you reply. So you have to make sure that you create a rapport, a dialogue with the patient. So you don't speak from the beginning until the end by yourself. This is not a monologue. You have 3 minutes at the exam for each roll card to prepare the conversation, or at least to understand what you have to do or what the problem is. And I'm going to show you now the task. And you will see the type of information that you get in the roll card and what you will use. First of all, we have a setting. And you see here we're in a hospital outpatient clinic. So that means that you either know or you don't know the patient now, depending on the situation. Since you are in a clinic, you might not know the patient, but we'll see later if you do or not. This information here is information for you to understand the task, understand the type of patient you are dealing with, or understand the medical problem. You will not use this information in the conversation because you actually have to ask questions from your patient, get information from your patient in order to get this information. But this is just for the purpose of the task. So you see that you have a patient waiting in the preparation room for a surgery on cataract surgery on his eyes. He or she, well, in this case, she, because I'm the patient, is quite nervous, and you need to talk to the patient through concerns of her for the surgery. Okay, so now, since the patient is waiting to get into surgery and you need to go to talk to them, you either know the patient or you don't know the patient, but you should know who you are talking to. That means that you can introduce yourself, but you don't ask me my name. You can confirm my name if you want to, just to make sure that you are talking to the right patient. But otherwise, you should know the name of the patient that would go into cataract surgery later. Okay, does that make sense?
Yep.
Okay, great. Now, this is the task. So now you have to pay very close attention to the information. But since this is plenty of information here, I suggest that you focus on the verbs. What do you have to do? You have to greet the patient, ask how she's feeling, find out the procedure, if she knows anything about the procedure. Greet, ask, find out, then reassure, explain, explain something else, stress the need to, emphasize the need to take care. If you pay attention to these words, then you can anticipate how to speak to your patient a little bit, right? Because then you understand that your patient needs quite a lot of information. She will probably ask a few questions. You have to provide that information. You have to answer. After you answer the questions, you have to get the reaction of your patient as well. So you have to wait a little bit for your patient to react to the information you provide. Make sure that you are always ready. When your patient voices a concern, basically this is your task to answer to her concerns. Whenever the patient voices a concern, you are always ready to say, oh, I understand you are worried about that. I know this is difficult to go through. I understand it's scary. I understand how you feel. You always have to provide empathy and understanding to their problems, fears, if they're anxious about anything. I would suggest that once you quickly go through the task, you create a little structure of the conversation in your mind, but you don't have to remember the task by heart because you will have the paper in front of you at all times. So when you speak to your patient, you will look at your task, okay? At the same time, you can look at your patient as well because that helps. To have eye contact with your patient helps you to create a dialogue, a conversation. This is what you would normally do in real life. So you can use that a little bit for the exam as well. But you have to keep your eye on the task so you don't forget what you're talking about or that you know what is next. Because if you know what is next, you anticipate, you get ready a little bit, it's a little bit easier for you. The task tells you what to say, but you have to use your own words. You don't actually read to me from the task. We're supposed to have a conversation. So that means that you have to use your own vocabulary in order to express what the task tells you to say. Another important thing in OET is you have to adapt your speech, your vocabulary to the patient. Now, in this case, we don't know the age of the patient, but we assume that it's an adult since they have a cataract surgery. So you can use normal language, sometimes a little bit elevated or maybe some uncommon words, very, very few, but you cannot use medical terminology. With neither of your patients, you can use medical terminology because the patient doesn't have medical training, so they don't understand medical terminology. In this case, I don't think that you actually have to use any type of medical terminology. There is none involved in the conversation. So I would like you now to take a minute and read through the task a little bit. And then tell me if you have any questions or if there are any words that you don't understand. All right. Okay. So we start with the greeting. We start with asking about the feelings, asking about information about the procedure, asking about concerns, and then we move through recovery period. What happens to the vision, to to her eyes after the surgery? How fast she will recover, if she will need glasses or not, if she needs to get a new prescription or not, and then what will she do after the surgery? How does she take care of herself after the surgery? Okay, and then medication as well. If she asks about medication, and she will. So, and then that would be the end of the conversation. At the end of the task, you will also end the task, because once you talk about medication, you don't just stop. You have to think about like a regular conversation. How do you end that? So you also have to say something such as, if you need extra information, please let me know. I will be here to answer your questions. Okay, and then that would be it. Who would like to do the task with me?
I can start.
Yes, sure. You will start, because you will be the one starting the conversation.
Okay, thank you. So first of all, if we have surgery today, usually we prepare the admission document. It's not in the task, on the task, but
No, but because we only have the conversation, your conversation with the patient, we don't talk about the procedures, getting admitted, and
only how, yeah. So
only
we
what you
need
have in the
to,
task.
yeah. So we go to the patients and have to identify about the number of hospital, and then we can introduce to him and say, hello, you are Mr.
Okay, just a second, Juliana. You
Yeah.
actually start as if you are in the consultation room with me. So we don't talk about we would usually do this. No, you do it. You have to do it. You talk to me. I'm your patient.
Okay.
Okay.
Hello, Mihaela. Good morning. How are you feeling today?
Good morning. I'm okay. I'm waiting for the surgery. I'm a bit concerned about it.
Yeah, I understand you. I understand very well how you're feeling. Have you been informed about your surgery? How is the procedure, and what have to have before the surgery?
I
Because
have, yes, and I know about it, but I have some concern about anesthesia. Is it painful?
you don't need to be you don't need to be worried about that, because will be a bit of pain. You not feel you will not feeling big pain, and then will be locally anesthesia locally.
Would I be able to see afterwards?
I think you still need to wear some glasses afterwards, because a few days you will still will be under the pressure, like the surgery. So you will be like, the recommendation of the doctor will probably say exactly if you can see properly, but I think you have to wear some glasses to protect your eyes,
I understand.
and the
How
surgery as well.
how long is the recovery period?
Probably 14 days or 2 weeks or more than that. But probably the doctor will explain you exactly how many times in how many times you will recover, and you will back to see how it goes after this period.
Oh, I see. You mentioned earlier that I might still use glasses. Would I need my glasses, or do I need to get a new prescription?
Depending what the doctor recommended to you.
I see.
I think
So I'll have to wait then.
Yeah, if you don't, sorry for that. Probably all the information we will have after the surgery. So you not need to be worried about that. You will be safe in this area, and definitely you will see much better after this surgery.
I
And we will
understand.
here to support you as
Um,
well.
is there anything that I can do or cannot do after the surgery during the recovery period?
Probably you have to have more rest, and you're not getting a big effort after surgery, probably 2 weeks. You will have more than if you work, you will have a sick notes. So to be safe at home, not in your work.
Oh, I understand. But when I am at home, what do I have to do in order for the surgery, the eye to heal well? Do you have any recommendations?
Probably to not have a big effort.
Mm-hmm.
Um, you can solicitate to many times your eyes. And for protect, I think it's a bit better to wear your glasses to protect the surgery.
I
Or
see.
one of the relative or next of kin have to be with him, but probably he is not alone at home. If it's alone, uh, can he have someone with him at home to give food, to give water, to or no? If not, he can remain in hospital a few times.
I
To
understand. What if it gets painful?
after surgery, probably the anesthetic will be. I never involved in the surgery. I work in acute, but um, I think will be a few hours. And if you need help, we will prescribe some medication for your pain, like paracetamol or ibuprofen. Sorry. If you're feeling pain. If
Mhm.
not, probably in a few hours you still getting much better. You will be much better.
I understand. Oh, well, thank you for the information. It was really helpful.
Thank you. Thank you very much. And hopefully I will be here to help you as well, to support with any question. If you ask me,
Okay. We
I
can
will
stop.
be
We
here.
can stop. We can stop. You can stop.
Okay.
Okay. I'm not sure if you were looking at the task during the conversation, because at some point the conversation went in a different direction, or you were not actually speaking about what was in the task. When you talked about the next of kin, that's not in the task.
Yeah, it's not.
Okay, then there were a few things that you didn't mention during the conversation. So then I suggest that you look at the task when you do the task. Because, for example, if I ask about what if it gets painful, you immediately talk about painkillers. Or you talk about medication, you can definitely take medication. We will give you a list of medication to take. It's very important. See, the last thing, stress the need for compliance. It's very important that you take the medication as prescribed.
Yeah,
Okay,
yeah,
and
definitely it
that
is.
would have been all. Now, remember that you have to allow your patient time to speak. So after you provide the information, you have to stop because otherwise your patient will have to interrupt you. So if your patient wants to say something, you have to stop and you have to listen to the patient, the question, the reaction, the whatever the patient says. If you would keep your eyes on the task, then it's a little bit easier. The task is there to help you and to guide you through the conversation. You don't need to invent the conversation. It's already here. But what you need to do is use your own vocabulary to do that, right? To navigate through the questions and the answers for your patient. Okay, well, this is the task, basically. This is what you have to do. As long as you can manage the structure of the task, meaning you can ask the questions, you can provide the information, and do that looking at the task, then everything will be fine. I mean, you will be able to have a successful consultation with your patient. You have to pay attention a little bit to not changing the task, because for example, Juliana, you towards the end, you were talking about the third person. I don't know who you were talking about, but you were supposed to talk about me. I'm the one going into surgery, not somebody else, and you were using he or she, but you are talking to me, right? Okay.
Yeah,
yes.
yeah, she.
Yes, and another thing, which I suggest that you avoid doing it in any of the tasks. If it's not specifically mentioned in the task, don't involve the doctor. The doctor sent you to talk to me about all this information. So you don't say, well, the doctor will explain, because that's why you are here having the conversation with me. So you can't involve someone else that doesn't actually exist in the task. That's why the task is really helpful, because it tells you what to do. It tells you what to say. So it's really useful if you read the task. Since at the exam, you don't have a lot of time to read everything, that's why I suggest that you look at the task during the conversation so that you know what you're talking about, right? Make sense?
Yeah, definitely.
Great.
Thank you.
Very well.
So on the exam will be the task. So they will be gave like that, like you said, or will
Yes.
be the many tasks or only few or 4,
Two
5?
of them. Two of them. I can stop sharing now. So let's go over the information a little bit. We have 2 consultations, okay, 2 different ones. And you have 3 minutes to read the first task. Then you have 5 minutes to do the consultation with your patient. Then you get the second one, 3 minutes to read, 5 minutes to have the consultation. And then that's it. That's the end of the speaking task.
Okay, thank you. Thank you very much.
And you have, the task looks exactly like that. You have to go through and understand what's going on. And then you will have it in front of you all the time. So you can look at it during the consultation. You don't have to remember it by heart.
Yeah, the task will be on the front of my eye.
Yes, this is not a memory test, right? In 3 minutes for you to memorize all the information in the task.
So will be only 3 minutes to
3 minutes to read, and then 5 minutes to have the consultation, the discussion.
Okay, thank you. I never tried the exam and I don't know exactly how it is.
Well, it's good. It's good you joined then. You get information now.
Thank you anyway.
Okay, well, I see other people joined the class. Welcome. We are near the end of the class. Do you have any questions?
No.
Teodora?
Not really.
Okay. Hi, Wana.
Hello. I just remember this speaking task because I did it before in a previous class. Yeah, and I remembered it.
Good. Well, thank you for joining the class today. Thank you, Juliana, for doing the task with me. I will see you at our next class. In the meantime, have a good day.
Thank you.
Yeah. Thank you. Thank you, everybody. Thank you,
Bye.
you too, special. Have a